Thank you so much for being with us here on ITV Gold. I appreciate your time and all the work that Manavi is doing right now. I hope you're doing well.
Yes, thank you so much for having me and allowing Manavi the opportunity to speak to you. Thank you so much.
You know, just starting this interview, Navneet, before we go into what is happening in the case of domestic abuse or violence in the nation right now, and a lot that we have to discuss, you know, for our viewers that may not know what MonaVie is and all the incredible work that you all have been doing for all these years, if you can give us an insight into MonaVie and all the resources available through MonaVie, just beginning this interview, I think that'll be really great.
Absolutely. So MonaVie is the very first South Asian women's rights organization that was founded in the country in 1985. So for the past 35 years, MonaVie has been providing culturally specific and linguistically appropriate services to South Asian survivors of domestic violence and sexual assault. And we basically, our mission is to end all forms of gender-based violence in the South Asian community. And we have a whole range of services. Would you like me to go through the services now? Sure. So we provide a range of services, including culturally specific counseling, advocacy. We provide legal clinics where we actually work with attorneys and provide a half-an-hour legal consultation over the phone for survivors. We provide support groups. Now it's more virtual, obviously, that we provide those. And we also provide medical and court accompaniments. We have an economic empowerment program. One of the most valuable services that we provide is Ashiana, which is our transitional home. That was founded in 1997. And essentially, it's a culturally specific South Asian home, and it's the only one of its type on the East Coast, where we house and accommodate survivors and children and provide culturally specific services. It's rent-free, and we provide everything for survivors there, and they can stay any period of time from a few months up to a year and a half. And finally, we have a 24-hour hotline, which is, again, culturally specific, and we have staff and volunteers who speak a range of South Asian languages, and we provide that service as well.
You know, let's talk about the issue of domestic violence and domestic abuse. I have a statement in which it says that the United Nations is describing the worldwide increase in domestic abuse as a shadow pandemic alongside COVID-19. It's thought that cases have increased by 20% during the lockdown, as many people are trapped in their houses by their abusers. You know, just starting off this conversation, Navneet, could you describe exactly what domestic abuse is and its different forms? And then to actually reflect on what the United Nations is saying, why is there such an escalated increase in these cases during this pandemic?
Sure. So domestic violence is an epidemic where the abuser exercises power and control over the victim. So there's a pattern of behavior where in any intimate relationship, the abuser is exercising power and control, and that escalates over a period of time. So you may not necessarily see physical or sexual assault at the beginning, but as the abuser gains more power and control, you see various forms of abuse. And I'm so glad that you asked the question about various forms, because very often, especially in our community, there is this misconception that domestic violence is purely physical violence, and that is not accurate. So it's really important to reiterate that domestic violence comes in many forms, and there are a range of abuses. For example, you can have physical violence, but you can have verbal abuse, psychological abuse. You can have financial abuse where the abuser is controlling all the finances of the victim. You can also have abuse where they're isolation, essentially, because their movement, whether it's in person or online, is being totally controlled by the abuser. And sexual violence and domestic violence are two very distinct forms of abuse. So to define sexual violence, it's basically any act of sexual nature where you have not given your consent or where there is coercion. So there are two distinct forms of abuse, and there's a whole range, as I mentioned earlier.
Yes, for sure. And in terms of reflecting on the immediate impact of COVID-19, this 20% increase seems like a really large number. What is your personal take on it? And have you seen an increase of domestic violence during this pandemic?
So that's an interesting question. And this is something that all culturally specific organizations and domestic violence agencies across the state have been speaking about in New Jersey and across the country. That although we know there has been a significant uptick in domestic violence cases, domestic violence abuse, that hasn't necessarily translated into the number of calls going up. And we know the reason why. All domestic violence agencies, and we've all been discussing this across the state, the main reason is because if you think about being in quarantine with your abuser, if you're in quarantine with your abuser during a pandemic, you have very limited options or choices or opportunity to reach out for help. So although we are seeing a more intense form of abuse taking place, so we are definitely seeing intense cases, forms of abuse that we didn't necessarily see before, and much more severe. The frequency or number of calls in the past few weeks has not necessarily increased, although recently we are seeing that they are starting to increase. And I think it's because the abuser is so in control of the lives of many survivors who are in quarantine with them.
Right. And in terms of these survivors, how are they reacting to you when you're interacting with them right now? What are some of their biggest challenges that they're facing? And are they perhaps afraid a little bit due to this pandemic and the fact that they are constrained into specific places?
Yes. So there's, COVID-19 is a pandemic, and at the best of times, our survivors are in fear of being cut off and in fear of isolation and in fear, also reluctant somewhat to report to law enforcement because of various reasons, like their immigration status, for example, where their immigration status is dependent on the abuser and they rely on their abuser. For their status and the ability to stay here and financial security. So if you think about how they might feel during a global pandemic, absolutely, we're seeing and hearing situations where the survivors have to balance their need for food, shelter, childcare, financial security, food security, healthcare, insurance, immigration status against the daily abuse. So where most people during a pandemic, as we've seen, have grappled with, basic things like getting groceries, making sure that and we all have the privilege of being safe in our homes. For survivors, I think they have to make this judgment call where they see that the abuser is also the person who's providing all those fundamental securities, food, shelter, childcare. And there have been situations where they're reluctant to report because their abuser is the person who is the one who's earning the income. And in extended family settings, it's even more difficult because they're relying on the extended family support for their children. But the financial dependency, I think, makes it much harder for them because they realize that it's much more, they feel, I should say, that it's harder or more dangerous to be subjected to COVID-19. So they would rather suffer the abuse in their homes.
So then what do you say to these survivors at that point of need? And in terms of, looking at the economic as well as the health ramification of COVID-19, how has MonaVie decided to respond? And how are you personally reaching out to these survivors who are dealing with these situations and need help or need guidance?
So what we've been doing, we're working very, very closely and very actively with various state agencies in New Jersey. And I am so thankful that we've had phenomenal response from the New Jersey Coalition to End Domestic Violence. We're members of the coalition where over 30 agencies are members, and also the Department of Children and Families. So we work and have a very close relationship with these agencies where we have actually been getting support and funding and groceries. So what we do is we've been working closely with survivors to make sure that we are there and present and addressing their basic needs. So for example, we've ensured that we've been providing regular groceries to all survivors who need them during this time, whether it's our residents in Ashiana or survivors who are not in Ashiana. So we've been providing support with groceries. We've been providing support where their internet, Wi-Fi, telephone service has been cut off by the abuser as a form of isolation. And we've been providing support for them. We have virtual support groups where we are ensuring that we are providing the emotional support that they need. And also in terms of COVID-19, we have worked with the state to make sure that survivors get free testing and that it's readily available to them, but also the treatment and any health insurance or health care that they might need is provided to them without any barriers.
Oh, wow. Navneet, when we were looking at doing so many programs, I know MonaVie had a set of programs that it was functioning and operating prior to COVID-19. And I know you've had to transform some parts of it to adjust to, the ramifications of COVID-19. Could you explain, all of the changes you've had to make in MonaVie right now? And perhaps what are some of your greatest challenges that are, facing you in terms of just providing that care and that safety for everybody?
Sure. So like most agencies right now, domestic violence agencies, some of I think initially we really had to kind of think about ways where we can bring all our services and support online and remote. So even though initially we had a few challenges, I think over time what we have done is, like I said, the 24-hour hotline we've always had, and that has been huge for us. But for example, support groups, they used to be in person, but now we do the support groups virtually. So we offer virtual support groups, and we have seen great response, and survivors have given us great feedback that has been something that has really been meaningful to them. At the same time, legal clinics, we've been doing them over the phone, which we did before, but now more so in a more enhanced way. We are keeping more in contact with our survivors virtually and remotely, even with our residents at Ashiana. We keep a regular check. And like I said earlier, some of the biggest challenges, I think, funding is an ongoing challenge. And I want to mention this specifically because, like many agencies, we have a portion of state funding or government funding, but then we all also rely on funding from our communities. And every year, MonaVie has an annual fundraising gala, much like all the other sister agencies, culturally specific agencies that I know of. So I think this is something I want to say on behalf of all our sister agencies, for anyone that's listening, that most agencies, if not all of them, I think, have not had the benefit of that fundraising from the galas that we used to do. So there has definitely been a dip there, and anyone listening, the one way that we absolutely value and appreciate the support from the community is through fundraising. And if you're able to provide funding during this critical time to the survivors and agencies, it would go a long way.
Navneet, there could be somebody that's watching you right now and could be facing some struggles of their own and could be needing help. I would love for you to give out a word of encouragement or perhaps advice to people that are suffering in silence right now, especially in this pandemic. What should they do according to you? Who should they reach out to? And how should they take care of themselves?
So the first thing I want to say very clearly to you is that you are not alone. Please know you're not alone. We are here to support you. In addition to MonaVie being here to support you across the state in New Jersey and across the country, there are a whole range of sister agencies that are out here with us to support you. We also have a 24-hour hotline. So if it's difficult for you to call us during the regular hours, you can call us any time during the 24-hour period, whether it's a weekend, late at night, and we've had those calls. And our hotline number is 732-435-1234. 1414. Also, you can reach out by emailing us at manavie@monavie.org. We've also had survivors reach out to us via Instagram, via Facebook. So you have all those tools to reach out to us at the same time, and our support groups are open to you that you can participate in. One other thing I will say, something called safety planning, and that's really important. If you're a survivor and if you're in an abusive relationship, if you're experiencing or you think you are under imminent danger, of course, in that situation, we advise you to call 911. But if it's not imminent danger and there's a pattern of abuse, we do recommend and advise you to think about safety planning. Now, what does that look like? Essentially, what it means is you have an emergency bag where you have all your important documentation. This could be your immigration documents, this could be your kid's birth certificate, health insurance, bank statements, all these documents, or take pictures if your phone's not being monitored. But having all this documentation in case you ever have to exit or leave, having a phone where you can pay as you go, having some cash at hand, and also some practical tips that we always give. I know that it's not safe to be in your home right now if you're in an abusive relationship, but thinking about how to minimize the danger by thinking of a space in your home that may be more safe, meaning thinking about being in a space when you think the abuse may escalate, if you have children especially, to be in a space where there's no objects that can be thrown around, there's no glass, there's no things that can be used as a tool. And also if you have a vehicle or a car, thinking about where you can exit easily out of the house and having an exit in your house. And finally, having a friend or a neighbor that you trust, who you can either speak in some kind of code word or code language. We've had situations where survivors have been able to alert a neighbor or a friend by using some kind of code word where they know they're in danger and the neighbor or friend can call the police for them, or even training their children to do that. So you have some safe mode of communication and a support system.
Navneet, thank you so much for those key tips. I think it's really important for people to know what to do if they are in a dangerous situation. And I really hope that they reach out to the resources that are available. What is your focus for the next few weeks? I have you here for just a few more minutes now. So I'd like to know what is MonaVie focused on for the next few weeks? While we're still in the pandemic, there's a lot going on. What are you truly, just driven towards right now?
So I think our primary focus right now is really continue to take the survivor-centered approach. So some of the things we're doing is making sure that all survivors that we're working with have all the essentials, like groceries, like all their bills paid, like financial security and rent. Rental assistance is a big one right now to make sure that they're not struggling with that. But at the same time, mental health support is absolutely fundamental. So we are working very closely with an organization called Samheen, and they provide mental health support to make sure that survivors have the mental health support they need as well, plus job skills and economic empowerment, so they're able to integrate back into mainstream society and be financially independent and viable.
Well, thank you so much here for your time on ITV Gold, Navneet. I truly appreciate it. I would love for you to give one last message to our audience, and perhaps again, encourage them to be a part of the cause and to truly, help the ones that really need it.
I think my final message to anyone and everyone listening in the community is that MonaVie is only able to do the work that we do with your support. We've been doing this for the last 35 years with significant support from the South Asian community, and we want to continue to do this and grow and expand and reach more survivors. So my request to you is, if you're able to provide support, whether in the form of donations, please do come out and go to our website at MonaVie.org and donate so we can support survivors, or volunteer for us so we can continue to empower survivors long term.